So tomorrow we can do, sir. So, sir, right now Varsha and Mona Lisa both of the.
Okay, today we will discuss about the case study. Do you have any idea about the case study? Mona Lisa? Hello, Mona Lisa.
Pranam, sir.
Yes. Good evening.
Yes, sir.
Any idea about the case study?
Yes, sir.
What is case study?
That is the detailed study of a specific subject, such as a person, group, place, event, organization.
Correct. So it is in-depth analysis. So what do you mean by the in-depth analysis? Varsha?
Sir, actually, case studies are done to those cases in which we do not get much of the sample. Like, for example, if it is a rare disease condition, so we don't have much knowledge about that. So, and nor we will get so many cases of that. So, one case which we get, we study it thoroughly right from the point of conception till the time how it has grown or become what it has become till now. So that in-depth study trying to relate everything's means the environmental elements, the psychological elements, social elements, everything they considered together and try to understand what has led this to come in and why it has progressed this far. So that in-depth study we do in case study, sir, of one person over or maybe whole of their lifetime, something like that, sir.
Yeah, so there is a model that is the agent host environment. Okay. Anjali, it is clear. Agent
Yes,
host
sir.
environment.
So basically, in terms of case study, you are saying
Yeah,
that
when
when
you are dealing
these
with
are
the
the
case study, then you are dealing with the particular case. That case is the host. Okay. Host is affected by some agent. And agent is coming from the environment. So agent, host, and environment. That is the model.
So it becomes a cyclic move, yes, sir. Host is being affected by agent, agent is being
Yes. Correct.
having environment, and now this environment again affects the host that is being
Correct.
making the agent to work.
Very good. For example, COVID-19. So if we want to follow the agent host environment model, then what will be in COVID-19?
Sir, in COVID-19, host becomes uh, the disease
Virus.
condition, the COVID which we
Basically
got.
the virus.
Now
Right?
this is being caused by virus.
Yeah,
That
so
is the
host is
agent.
the virus.
Now this agent virus is living in the environment, that is in our uh, area, in our air, in our environment. So that becomes the place from where it is coming.
Yeah. And host is the person.
Yes.
Yeah. Person. Agent is the COVID virus. And COVID is coming from the environment. So when you want to do the case study, then you have to think about this model. What is this? How it occurs? Okay. Suppose one patient came to you with the complaints of depression. So you have to study what are the features of depression individual possess and what are the factors contributing the occurrence of the depression. Again, from where the factors are coming. Okay. So it will be in-depth analysis in case of the individual. But in case of the between individuals, for example, agent is COVID. COVID-19 affects two persons. And one person is suffering from too much depression. Okay. But other person can develop the resilience. Now the question comes, both individuals are affected by COVID-19. And COVID-19 from the same environment, but the reaction of the patient to COVID-19 is different. So what are the underlying factors? Okay. So that means this is the in-depth analysis. And to study this, if you administer the questionnaire, that is not sufficient. Right? You have to study thoroughly. And you have to collect the detailed information so that you can develop the insight. So can anybody tell me why another person develops resilience, but other person cannot?
Sir, it can depend on multiple factors.
For example?
Like, for example, the previous means the pre-morbid condition of that person before he contracted the disease. How was the lifestyle, the diet, the um the level of or the amount of exercise they were doing, their physical health. Also, some
Okay.
other extra, like these were the internal factors, but there could be some external factors like the environment when we are talking about. So, in the environment, the availability, because one could be resilient because the environment is good, or they are in that kind of um, um, society, no, not society, like the community, or where things are, resources are easily available. So in that case also, if someone has lesser resources, they might not be able to overcome some issues easily.
Correct. Varsha, any other observation?
Sir, it depends on the environment in which they are surrounded. See a COVID person who is living with the family. So the family support is there. So that person will not feel that much depressed than to the person who is living alone. Though both of them will undergo isolation, but the way the isolation that the alone person is facing, because he's all alone, his environment is like that, he has got no other people to support him, whereas the other person has got support system, so he knows that something will happen, there is somebody who will help me. So the reaction towards the disease condition becomes different.
Okay. That means SOR. S means stimulus, O means organism, R means
and
response. Okay. So there is some mediating variable that operates between the two. And what is that mediating variable? From the internal point of view, that is the person who is able to develop resilience, his trait anxiety is low in comparison with the other one. Okay? The person whose trait anxiety is very high and the person is affected by COVID-19, then it becomes difficult for the individual to develop the resilience very easily. Okay? And from the environmental point of view, that is the family support or social support system. Maybe in case of the resilience individual, the social support system is good. Therefore, this patient is able to develop the to overcome the sufferings. So when you want to do the case study, then you have to think not only the independent variable nature, not only the dependent variable nature, but also you have to find out whether there is any mediating or moderated variable are there or not, and how they are acting. Therefore, you have to take detailed information. This is clear to all of you?
Yes, sir.
Okay. Now, since you are dealing with the single individual or the only two individuals, you are not able to make any generalization. That is the limitation of the case study. Okay. Another thing, there is a high chance for biasness. Subjective biasness is high in case of the case study report. Now, for the case study, there are some steps of research. First one, identifying the research question. Okay. Initially, you have to identify what will be your research question. For example, can individual be able to develop resilience who is suffering from COVID-19? Maybe that is your research question. Or can COVID-19 affected person be able to develop resilience? Maybe that is your research question. Second phase, selecting the case. Then you have to select a particular case following the inclusion and exclusion criteria. This is the second step. Third step, designing the study. That means in your case study design, you have to write down possible exploratory and explanatory variable. Exploratory and explanatory variable. Fourth step, collection of the data. So by using the interview, observation, document, or archival records, you can collect the data. That is the fourth step. Fifth step, data analysis. If it is interview or observation or documents or archival records, whatever the things are there, you have to analyze them. Next one, interpret the findings. Whatever the results you will get out of the analysis, you have to interpret the findings. Next, drawing conclusion. And reporting the case study. Okay. So Mona Lisa, can you tell me the steps for case study?
Sir, initially, we have to identify what will be our research question.
Correct.
Second, selecting a particular case following the inclusion and exclusion criteria.
Bah.
Third one, designing the case study. We have to write down the possible exploratory and explanatory variable. And fourth is collection of the data by collecting the document, archival, etc. And five is data analysis. We have to do analysis of our documents and archival, etc.
Very
And
good.
six is interpreting the findings. Whatever the result we are getting for the analysis, that we have to interpret the findings, sir. Seventh step is drawing conclusion and report what you told, sir.
Wow, very good.
Yes, sir.
So Barsha, have you observed the note-taking behavior of Mona Lisa?
Yes, sir.
Mona Lisa is very punctual in
good.
note-taking.
Yes, sir.
It's very systematic. She is very systematic, and I have observed carefully. That is, she has this type of temperament. It's a note taking. Now we have to learn, that is, what is the difference between case study and other methods of research. First one, depth of analysis. In case study, there is high level of depth exploration, but in other methods, the depth exploration is less. Okay. Anjali, can you tell that is why, how depth exploration is very high in case of the case study in comparison with others?
Sir, I do not understand the question. Can you?
In-depth exploration.
Yes, sir.
In-depth exploration is very high in case of the case study in comparison with others.
Other kinds of other approaches to doing researches.
Yes.
Yes, sir, because in case study we usually look at a single subject. We or if like the sample is very small, so that the in-depth exploration can be done. When we talk about other approaches, we focus on the generalization. So one of the major purpose of other approaches of research is to get the finding, and then so that we are able to generalize the results. But that is not the case for case study researches. We do in-depth analysis, and that is the priority. But for doing in-depth analysis, we cannot do it for large number of people. So we limit the number, limit the quantity. Usually we keep it one case, or like a small number of cases only, and do the in-depth analysis. But that makes it a limitation, as you also told, for the case study approach, that it cannot be generalized in a way in which other approaches can be generalized.
So that is the advantage in case of the case study. No? We are dealing with only one case.
One case, yes, sir. But we are doing in depth.
Yeah, in depth.
Yes.
Next point, contextual understanding. In case of the case study, main focus on the context and unique characteristics surrounding the case. Context and unique characteristics surrounding the case. That is important in case of the case study. Number 3, qualitative emphasis. In case of the case study, data are qualitative in nature, and it covers the detailed description and interpretation. Next point, longitudinal perspective. In case of the case study, you can study the case over an extended period. You can observe the behavioral pattern of the case over 6 months period or over 12 months period. Case study is basically the subjective nature. And in case of the case study, you will get unique experience. Next one, flexibility in data collection. In case of the case study, you can include interviews, observation, document analysis, etc. But in other methods, you are following the structured approach. But in case of the case study, you are guided by the research question and you are following unstructured format. So it will be open-ended. Okay. Now, can you tell me that is how case study is related to applied psychometrics? It is qualitative, but still it is applied psychometrics. Why?
Sir, applied psychometrics basically focuses on action research.
Yeah.
And action researches are on the spot researches things. So that again, you'll not have a good background or a good literature of all those things. You have got a hand-on problem. So that has to have a solution. For that, we are doing the research. So a case study would give you a good exploration of the thing and probable problem solving ideas and decision making also, sir.
Yeah, very good. Because based upon the case study, then you can think about the test development. Okay. For example, initially during my counseling, I observed that is most of the patients, they have poor reading and writing motivation. Suddenly I observed. And then I was thinking that is there any research on reading and writing motivation? At that time, I have seen some paper on reading and writing motivation, but that does not help me to understand my client. Okay. Then I constructed the reading and writing motivation questionnaire. And I tested its reliability, validity, etc. So, from the case study, but here, case not the single case, multiple cases, because they are coming to my chamber, and when I have taken the case history, then I have realized that there was some gap in their reading and writing motivation during the childhood stage. Mainly, they are externally motivated. I do not find much internally motivated patients. Then I have related this issue with attribution theory, that is external attribution. And then I am thinking that is possibly there will be intrinsic and extrinsic reading and writing motivation. So I have to find out what is the intrinsic and extrinsic reading and writing motivation. And then I developed the question. I tested reliability, validity, etc. I have applied the this questionnaire for educational counseling and guidance. Okay. So case study is the root. If you do the case study, then you can get some unique experience. Okay, Barsha, have you seen any person, some unique experience? Unique person?
Unique person in the sense, sir, to study, to carry out a case study.
Yeah, at least we can study that individual because some unique behavior you have observed. Have you seen
a
anyone?
person. Yes, sir. There was a child. He has some intellectual disability, but his parents have not mentioned it. And the child is quite good, normal. He looks normal, but when it comes to academics, he's not performing well. In actually saying that yes, he does not score good marks. But if you observe him seeing the skills, like for example, he was very good with numbers.
Okay.
Like the subject which I was teaching him, that was not that was a social science. Okay, so when I was teaching him social science, he would not write any answer there. So when I checked his answer sheets and I gave him the answer sheet, he just saw the marks and he said that it is just 30% without calculation, without anything. So that showed me that yes, he has some learning difficulty, but his parents said that no, he does not have anything like that. The parents are not at all receptive.
Okay. So this is a unique experience. Okay. Now, Mona Lisa, have you seen any person, some unique experience?
Yeah.
Can you remember any particular case? Okay, cannot remember. Anjali? Anjali, can you remember?
No, sir. Right now, I don't remember any exceptional case.
Okay. Have you seen Tare Jamin Par?
Yes, sir.
So that
Hmm.
is the case study.
Yeah. So, but sir, what we usually say, like any case cannot be done, na? Like the example which Varsha ma'am gave. So that could be studied because, so for example, intellectual disability, if we talk about, that is well known. But the condition which ma'am is saying, that the parents were not receptive and the child was able to perform, like the mathematical calculations were good, but the other subjects he was not able to perform. So what could be the reason? That kind of case, so that uh, I feel that that kind of a distinct case in which we do not know something or something is not that general can be studied. But if general cases are there, that I think that don't need case study, right, sir? Like,
Yeah, the Tare Jamin Par, that is a case study.
yeah, that
Tare
can
Jamin
be
Par,
one example.
that is not the general study. It is a
Yes, yes.
case study.
Hmm. But sir, in that sense, like in Tare Zameen Par, they portrayed a dyslexic kid,
Yeah.
and they talked about the dyslexic kid and how he was not diagnosed, and later on there was a diagnosis done by the protagonist, and then later on it led to the further growth of that. That can be said. But like what I remember in my experience, as you asked the question, that if I have like I have encountered such a case, that's what I'm saying, that there I can't remember anything specific or special something. Like there were cases, but general cases only.
Mm. Okay, actually, everybody has experienced some unique features, but that
Hmm.
unique is to that individual,
Hmm.
uniqueness not to the all the people,
Oh,
but
yeah.
sometimes you will find some uniqueness in
Hmm. Hmm.
someone's behavior, or
Yeah.
maybe own behavior, you will find suddenly some unique features.
Yes, yes, sir.
That is possible.
Yes, sir. Sir, like that, because you gave example of movie, A Beautiful Mind is also a very good case
Yes.
study, which is about a real person, John Nash, Dr. John Nash. He was a
Uh,
mathematician, and it is very unusual that while experiencing a very severe mental disorder, also he became a Nobel laureate. So
yeah.
that was also a good case study.
The physicist is also there, na? What was his name? Hawkins, something, who was on
John
wheelchair.
Hopkins.
Yes, he was also of the same thing, na?
Yeah,
No,
yeah.
yeah, no, Stephen Hawking.
Stephen
Stephen
Hawking.
Hawking. Hawkins.
Yes.
Yes, that is also, yeah, because he has a neurodegenerative
Yeah,
disease.
degenerative disease, but he did
Hmm.
not give up.
Yes.
So you will find the case study, and case study leads you to think about some research.
So there is a different way of writing case studies, yes?
Yeah, reporting of the case study is different. In case of the case study, reporting will be very detailed, very much detailed.
So it will be like a narrative one?
Yeah, it is more narrative, more explanatory, more justification. But only problem is that there is a chance for high subjective biasness.
So then do we use the other literatures also to support our answer in this?
Yeah, that we can use it. Literature review, that is also possible. Because in the literature, this type of unique experience is not there. Maybe Tare Jamin Par you are writing, then learning disabled or learning disability, maybe your area. And how to treat the dyslexic child, and what is occurring in the mind of the dyslexic child. Maybe that type of research was not available. So therefore, you are highlighting this type of issue. That is the case study. Case study can happen in any area. Not only in psychology, case study is very useful in case of the management, in case of the economics, philosophy,
Medical field, maximum.
sociology, politics. Everywhere you will find the case study. Sometimes case study will be based upon single case. Sometimes it is based upon the multiple case. Maybe case study is only particular event that happens. So that is the case study. For example, what was happening in Uttarakhand, the rescue operation. Can you remember that event? So that particular event may be. Okay, so now you have to write at least one case study. Maybe that is related to the educational issue or some psychological issue or some management issue. You can think about it. Okay. Farah, last time what case study I have given?
So they have to choose their own topics, sir. Like if they're getting this any patient, I mean any individual who is facing anxiety problem, then they can have it. They can have the case study on them, but they have to do the assessment by their own, sir. Like we will not provide them any anxiety questionnaire.
Okay, okay.
Yes.
Okay, Varsha, Anjali, Mona Lisa, it is clear to you, I think. So please
Yes, sir.
prepare one case study.
Okay.
10 marks is there. And whatever I have taught today, that is available in the Google Classroom. Okay. Okay. Good night.